Medication-assisted treatment. All right, if you are on the opioid crisis highway and you're wondering, is there any hope for me getting off this highway? You wonder how long before I can find an exit, and where is that exit? Well, we're going to talk about that, and I want to give some hope to those that might be wrestling with substance use disorder. And please, you need to stop and listen and think. Perhaps you're working too hard at the wrong thing, and you're trying multiple times to change your addictive cycle and you just can't do it. Well, I want to give you some hope, real hope. And if you have hope for the future, you have power in the present. And just realize, you may not be able to do everything all at once, but you can do something. So let's look at the road we're going to travel. First of all, let's talk about what does it mean to be in a medication-assisted treatment program, MAT. It sounds great. I mean, it sounds like the medication helps you to address the treatment. Well, we'll talk about that. And let's begin with the end in mind. If you believe that you need to be on Suboxone or Methadone for the rest of your life, that's not what we're thinking. So let's begin with the end in mind, that it's possible to get at the root triggers of why you have challenges with substances and that you may not be on anything at some point. If we treat the root, not the fruit, that's a real possibility. Also, it's important to realize where the money is flowing with medication-assisted treatment programs. The reality is it's a merry-go-round of rehab programs. Taxpayers are paying millions and millions of dollars and seeing very little fruit on the vine. So what is MAT? MAT, by definition, and this is the Pennsylvania Department of Corrections definition, they say medication-assisted treatment is an innovative, pioneering program, but when they define it, this is what they say. Medications including methadone, naltrexone, buprenorphine are given to inmates. The medication assists by curbing opioid cravings, allowing inmates to focus on re-entry and rehab. The treatment, like with anxiety, cholesterol, or high blood pressure, the medication is part of an overall treatment plan to help manage the symptoms. And if you notice, they're managing the symptoms. And so the question is it really getting at the root of the problem? If all we're dealing with is symptoms, we're not getting at the triggers. And while these medications, Suboxone, Vivitrol, Methadone, they're great temporarily, but that should be a bridge to getting somebody completely healthy. And that's not an easy thing to do. You may be dealing with an athlete that developed an injury, became addicted to opioids. The doctor finally said, well, I can't give you any more, so she goes to the streets to get opioids, ends up incarceration, has a very complicated family history, and fortunately she was able to go through a program that got at the root and was able to leave a correctional setting and live a more productive life. That program that she entered was at Western Virginia Regional Jail. It's a 16-week program, and Leanne Sparks is the bulldog that just coordinates all this activity. The program is successful for a number of reasons. It's a 16-week program, and they try to get at the root. And what's the root of addictions? Well, if you look at a tree, which represents a tree of addictions, you can see that there are a lot of addictive behaviors. Gambling, sex, religion, food, drugs, work can be addictive. And actually people, codependency, become addictive. And alcohol. But what's at the root of all that? And what feeds that root? Well, shame hides everything. See, it's embarrassing for some people to address that. Loneliness, fear, grief, anger, their genetic predispositions, emotional abuse, sexual abuse, spiritual abuse, and physical abuse. Those are all hidden in the soil of addictions. and shame covers them all up. And what we like to tell folks and encourage anyone listening to this, you can't change the past, but we can reframe it. And if we reframe the past, it's possible to not deny all of those triggers that are in the soil of addiction, but actually address them. There are a variety of tools that can be used. Voice mapping, which is EVOX. DNRS is dynamic neural retraining systems. There's some great counselors out there. And there are some visualization techniques that are effective in pulling out the roots that are causing addictions. Confession is a very powerful tool. I believe the AA 12 Steps is one of the best, excellent guides to guide someone through the layers of shame and hidden triggers that are perpetuating their life of substance use disorder. Part of the AA 12 Steps is forgiveness, and that's a decision. You may not like someone, and actually it's probably okay to dislike them, but you can also love them. Liking someone is an emotion. Loving someone is a decision. And it is possible to forgive somebody for the wrong that's been done to you, and by choosing to do that, you cut off the power cord of the impact that evil has on you. If you decide not to forgive someone or choose not to, then you're allowing that trauma to continue to be the power that stimulates substance use disorder. So consider this. Perhaps it's a mom, dad, a spouse, best friend, family member that hurt you. You do not have to wait until they ask forgiveness from you. You can choose to forgive them and say, I am going to cut that power cord off. I did not like that bad situation, and it was not good, but I'm going to love you because love is greater than evil. That sounds simple, but it's actually a very powerful tool. Drema is an LPN that was at Western Virginia Regional Jail, and she was a key part of doing daily rounds. She was like a mom, cousin, grandma. She would see them every day and frequently do their Hamilton A and Hamilton D scores, and also assisted with brain maps. We'll talk about those brain maps in a little bit. And it was her daily connections with them that was powerful. She earned their trust, and she could see who was not following through with the daily requirements that were needed to succeed. When someone comes into the program, they begin at the bottom, and then they're given more and more responsibilities and leadership. So at the end of 16 weeks, they become leaders in the program. And some folks take a while to get through this 16-week program. Some people have such a strong family history and drug use, it takes them a while to learn how to communicate. In fact, some people have a hard time communicating with their lips, and they communicate with their fist. And as a result of that, it takes them much longer than 16 weeks to get through the program. But we do not give up on them unless they give up on themselves. And some folks are forced into the program by an overdose, but actually that overdose might be what saved their life. During conferences, sometimes you might need a break. And so if you're tired or you need a break, just take a 10-minute break, chill out, and then we'll come back and keep talking about medication-assisted treatment. All right, we'll pick up where we left off. MAT 101, medication-assisted treatment. They say it's innovative and it's a pioneering program, but I disagree with this definition. This is the Pennsylvania Department of Corrections definition of MAT, and I highlighted some of the areas on their description because I want to point out that yes, there are medications, and I agree with those medications can be life-saving. That is a truth. And it's supposed to assist, and I highlighted the word assist. Yes, it does curb some of those cravings, yes, and it might keep them alive. treatment, I disagree with this in that they say it's treatment. I do not think that anybody has a Suboxone deficiency and we have to give them Suboxone. I don't believe they've got a methadone deficiency. They might have some tendencies, family history that pushes them into that realm, but it's not like other medical challenges, diabetes being one. Some people must have insulin. I disagree that it's in that category of a disease that must have methadone or Suboxone. And I say that because we've seen success. And remember, some folks are on the MAT merry-go-round treatment and rehab program, and they're pushing so hard, attempting to get success, but they're not getting where they want to go. So let's just pause and consider, is it possible that if we gave people wrestling with substance use disorder some micronutrients, is it possible that if we gave them those micronutrients, that some of those cravings actually might go away? Well, that's what we did at Western Virginia Regional Jail. Thanks to the state of Virginia for giving us a grant to purchase Intramax and Synaptogen X for all of those in our program. And here is a side note, I have no financial interest in any of these products. I am not part of their sponsorship. There's no way that speaking about them rewards me financially in any way. We also found that other supplements besides Intramax and Synaptogen X were very helpful. Daily essential nutrients and perfect amino acids are very good products that can help replace what might be missing in the brain. A lot of folks try to argue and say, well, how do you know that those supplements are actually effective? Well, there's a symphony of chaos in someone wrestling with substance use disorder. And so it's real hard to pin down they need exactly this supplement or that supplement. And so we can't judge by one supplement. We really have to look at the whole picture and decide that if they sound better, they're thinking better, the anxiety's gone, then we must be doing something right. And it's hard to measure that with blood tests, so how do you measure that? Well, one way to measure that is something called cortical metrics. I have no financial interest in this either. So what is cortical metrics? It is a handheld device. It looks like a mouse, but it doesn't function like a mouse. And it's a test that the individual is tested by receiving stimuli on that device with their index finger and middle finger. And so there are vibrations that come at different times and different coordinated patterns. And the person is asked a number of questions. And when they complete that, you can get a fairly good assessment of their baseline brain. And the goal is to then intervene and see if you can improve those areas of the brain that have been harmed. There's an example of someone with a traumatic brain injury, and as you intervene, you can retest to see if you're making headway. And so what does it look like in the world of substance use disorder? Well, you can see on the left that there are some areas that are not as effective as they should be, and after intervening with a number of things, not just the micronutrients, but also the emotional, spiritual, physical needs, we can see that there's definitely been a change in this individual. When we think about substance use disorder, we have to remember that substance use disorder or mental illness, they're co-occurring. And you really have to get involved in every aspect of the mental illness. And unless you address the mental illness, most likely the substance use disorder will continue. There's a very high incidence of substance use disorder in those wrestling with gender dysphoria. And it's a challenge to try to get at the root of the gender dysphoria. But if you're not successful, the likelihood of substance use disorder and increased suicide is undeniable. So what happens when someone leaves a correctional setting? Well, unless they're prepared for life, it's actually not easy at all. And I challenge anyone to experience what some of these folks experience when they leave. They're given maybe $25 or $50 a bus ticket, and they have to go to downtown to find a place to live, and then they have to pay their court fines, and they've got to get a job. And it's almost impossible for someone with a few felonies and multiple tattoos to get a job. It's hard. People just don't want to see them. So where do they end up? Well, there are a number of substance use programs in the country, and more growing. In fact, they're growing like mushrooms. And why? Because there's gold in them hills. What do I mean by that? It is extremely financially rewarding to run substance use disorder programs. So someone with multiple felonies, they can't get a job, they can't pay their fines, they want to do what's right, many want to do what's right, but they just can't get there. So they end up in a substance use program, and many of these programs will allow you in the front door for free. And they often will tell you that, the first month there's no fee at all, and we can set up fee schedules down the road, and some will give them more than 1 to 2 doses of Suboxone strips. And I know that these Suboxone strips are sold on the streets. They will get them into the correctional facility, and you can make a lot of money on Suboxone strips. So, for example, a Suboxone strip on the streets is anywhere from $20 to $30 on a strip. So if you're given 2 or 3 of those a day and you sell them, you're making $100 a day. And so here they might be involved in able to get unemployment. We saw some devastating impact of the COVID stimulus checks. They just used that money and diverted it. I knew of very few people that actually benefited from the COVID stimulus checks. And so they get unemployment, they get some strips from the rehab place, they may get some stimulus checks down the road, and they can stand on the corner with a sign. And this may sound cruel or brutal, but I'm telling you, I know this because I have worked with many people, and this is what they do. So unless we change this paradigm, this dysfunctional behavior will continue. A major subset of people with substance use disorder are veterans, and they need help. There's a lot of PTSD that's not appropriately addressed, and it's hard to reframe the past with some of the military veterans. It's also important that we treat the family, not just in veterans, but in everyone. All of those wrestling with substance use disorder, you really have to get the family together and coordinate family restoration. Medications do not heal the brain. We've talked about the micronutrients and some other interventions. Something we haven't talked about is hyperbaric oxygen. There are some studies being done now looking at hyperbaric oxygen to heal the brain. Another option is to consider low-dose naltrexone. Low-dose naltrexone can be used, but not when someone's on opioids, because it will put them into withdrawal. And so low-dose naltrexone is perfect because it can help with anxiety and pain and chronic pain, but not someone that's on opioids. Another medication that has some promise is tadalafil. Tadalafil is very interesting because it may afford pain relief. It's a PDE5, which is a phosphodiesterase inhibitor, and it improves blood flow. And there's been some success using tadalafil for pain. Another creative way to help not just veterans, but families that have had dysfunctional interactions is horses, equine therapy. The Healing Strides in Virginia is currently working with inmates from Franklin County, Virginia, and they're exploring grants to restore the parental, child, and family relationships with veterans, but also those with substance use disorder. While folks are in prison, if they're not given tools they need to succeed, they're very likely going to fail. There's a very successful program in Texas called the Prison Entrepreneurial Program. And they have a long record of success of preparing those within a correctional setting to succeed, not just those with substance use disorder, but those in a correctional setting. And so let's encourage everyone to consider it's more than just MAT, medication-assisted treatment. They may require Suboxone and Methadone temporarily, but if you address the body, soul, and spiritual triggers that perpetuate substance use disorder, you're more likely to succeed. Thank you for your attention, and I look forward to helping those not only through sessions like this, but when you become a member of Embrace Virginia, you'll have ongoing access to helpful information such as this. Thank you for your attention.